Hello YouTube, I'm Dr. Fox. Today, I'm talking about an epidural. An epidural is a sort of anesthetic which is often given to women in labor. Medication is given through a tube inserted into your back and stops your feeling pain from the waist down. For example, so you can have a C-section or to help during a difficult or long labor. It is given by a specialist doctor called an anaesthetist who has had extensive training in giving different sorts of anesthesia in a range of different situations, and who will be able to tell you exactly what they are doing and answer any questions you have. Okay, question. Will you stay awake during the epidural? My answer is yes, you will. Unlike general anesthesia, the epidural only affects part of your body, so you can stay fully conscious while your baby is born. Okay, next. How does the anaesthetist attach the tube? The medical staff looking after you will make sure you know exactly what's happening at all times. Usually, they will put a drip in your arm first, so you can have fluids while you have the tube attached to you. Then, they will help you to sit up and lean forward or lay on your side with your knees up, whichever is more comfortable. First, you will have a small injection of local anesthetic to numb the bit of skin where the tube is to be inserted between the bones in your back. When that has taken effect, the tube is inserted. This may be a bit uncomfortable, but it is done quickly and the pain relief starts within 20 to 30 minutes. The tube will remain in your back for however long you need it, and the anesthetist will top up the pain relief drugs as necessary. In some cases, the epidural does not block all the pain, and doctors may offer you alternative or additional types of pain relief. Sometimes, doctors will offer you a mobile epidural which gives you a lower dose of pain relief but allows you to walk around. Okay, next question. How long does it take to recover? After the tube is removed from your back, you will probably stay numb for another few hours, and you should stay lying or sitting down as your legs will feel strange. If there is any pain, tell your doctor or nurse so they can give you pain relief. It's very important not to drive, operate machinery, or have alcoholic drinks for at least 24 hours after you have an epidural. Okay, next. Are there any risks or side effects? Although epidurals are usually safe, a few side effects or complications may occur, as they can with any type of medical treatment. You may find after an epidural that your blood pressure is low, so you feel dizzy or nauseous, or that your breathing has slowed down or you can't control your bladder. Some people have itchy or tingling skin or a headache. Medical staff will be on the lookout for all these possible complications, and you should tell them if you do not feel quite right so they can give you pain relief or check your fluid levels or blood pressure. If you wet yourself after you have had an epidural, it is because the nerves around your bladder are numb, so they are not sending the message to your brain that you need to do a wee. If necessary, the nurses will insert a catheter, and this situation won't last long. Sometimes the skin next to the epidural tube might become infected and you may need to take antibiotics. Occasionally, there are problems which need a bit more attention. Sometimes when the needle goes in, it punctures the bag of fluid which protects your spine inside your body, which can leave you with a bad headache. In this case, you may need to have a blood patch to stop the puncture, but your anesthetist will advise if this is necessary or if the headache will go away by itself. The needle or tube can also very occasionally damage nerves, so you get a small area of numbness somewhere in your body. If this happens, it will usually disappear after a few days or weeks, but sometimes it takes months to go away. Very rarely, permanent nerve damage is caused neither because the needle or tube has directly damaged something, or because of an infection, or because bleeding has put pressure on the spinal cord. Other possible but rare complications include fits and breathing difficulties. Okay, thank you for watching. See you soon.